I want to talk about CO2, carbon dioxide, in the thyroid, because I know you're a fan, I should say fan of CO2, but from reading your stuff, you talk about the thyroid, and you talk about carbon dioxide. How do thyroid hormones raise CO2, and what are the advantages of having higher CO2 levels?
That means that you're oxidizing things completely. If you oxidize fats completely, you get rid of any toxic effect from the free fatty acids. But you also stop producing lactic acid and stop that whole route of inflammatory, harmful processes of free fatty acids and lactic acid. But the carbon dioxide itself binds to all of our proteins. For example, hemoglobin in a diabetic, they look at the amount of sugar or fragments attached to proteins such as hemoglobin, but it's actually the breakdown of fatty acids which contribute about 95% of these glycated proteins that accumulate in diabetes and aging. But when we're producing enough carbon dioxide, it not only protects the cell by removing the excitatory calcium, but it also binds to all of our proteins that have a lysine group or another amine group exposed. And these amines are where the breakdown products, free radical fatty acids, and so-called glycation end products, it's where they bind. And so carbon dioxide binds protectively to proteins, keeping them in the native youthful state, which happens to be the things called hormone receptors are in a different state when there's adequate carbon dioxide. Insulin is in a different state. Growth hormone, all of our peptide hormones can bind carbon dioxide, becoming a different substance. So all of our hormone system is deranged if we just hyperventilate and blow out too much carbon dioxide, or if we're hypothyroid, basically we're in effect hyperventilating even at rest, producing lactic acid instead of carbon dioxide.
So what you're saying is the more CO2 we're essentially producing, it allows our thyroid to work more efficiently, which is basically those levels are down-regulating lactic acid and serotonin and all these inflammatory markers. That's correct?
Yeah, the CO2 is in itself anti-inflammatory. A lot of hospitals are now recognizing that they were killing patients by giving them pure oxygen or even hyperventilating them, and they can prevent most of the hospital-induced lung failure and a lot of brain damage by giving them carbon dioxide or just hypoventilating them so they accumulate their own carbon dioxide to a protective anti-inflammatory degree.
Right.